Welcome to LifeRx Med Musings. If you've ever wondered what really happens behind the scenes in hospitals and clinics, you're in for a treat. Medicine is often portrayed as serious, life and death work hand. While that's absolutely true, there's also a side of it that's filled with humor, bizarre moments, and situations so absurd that you wouldn't believe they actually happened. Doctors, nurses, and medical staff deal with some of the most intense situations imaginable, but amidst the chaos, there's always room for laughter, whether it's a patient who misunderstood their diagnosis in the most hilarious way possible, a nurse who had to keep a straight face while listening to an outrageous story, or a doctor who got pranked by their own colleagues. The world of medicine is filled with moments that remind us just how funny and unpredictable life can be. So, grab a seat and get ready to laugh, because today we're diving into the lighter side of medicine. 1. When patients take medical terms way too lit. Of the funniest things about working in healthcare is realizing just how confusing medical jargon can be for patients. While doctors and nurses are trained to use precise terminology, patients often interpret things in ways that no one ever expected. Take, for example, the classic case of a man who was told by his doctor to take his medication once a day by mouth. The next day, he came back complaining that he couldn't possibly continue taking the pills, because it hurts too much to swallow them. Confused, the doctor asked him to demonstrate how he was taking the pills. The patient hesitated. Before pulling down his pants, turns out, he thought by mouth meant he had to insert it rectally. Then there was the woman who was prescribed a suppository for pain relief. When she returned for a follow-up visit, she angrily told her doctor that the medicine tasted horrible, and she could barely keep it down. That's when everyone realized she had been swallowing the suppositories whole instead of inserting them. Another classic mix-up involved a patient who was asked to provide a stool sample. Instead of the expected medical specimen, they proudly walked in the next day with a beautifully sanded and polished wooden stool. "You just needed one, right?" they asked. The entire clinic had to step outside just to laugh without hurting the poor patient's feelings. 2. The unforgettable ER encounters. Emergency rooms, ERs, are chaotic places where anything can happen. While doctors and nurses are always prepared for the unexpected, some situations are so ridiculous that even the most experienced medical professionals are left speechless. One night, a man rushed into the ER screaming in pain, clutching his stomach. The medical team quickly prepped him for examination, thinking he might have appendicitis or a severe case of food poisoning. But when they asked him what happened, he hesitated before mumbling, "I ate a whole bag of popcorn," including the bag. Then there was the patient who came in complaining of a headache after accidentally hitting himself in the face with a frozen steak. He had been trying to defrost it quickly by tossing it in the air and catching it, until he missed, and of course, no art is complete without the occasional odd object retrieval. Over the years, doctors have had to remove everything from remote controls to Christmas ornaments from places they were never meant to be. One particularly memorable case involved a man who arrived at the ER with a toy car somehow lodged in his rectum. When asked how it got there, he simply shrugged and said, "I must have fallen on it." The X-ray that followed became legendary among hospital staff. 3. The doctor's office blunders. Even the most skilled doctors aren't immune to making hilarious mistakes. Picture this. A doctor is performing a routine physical exam and needs to check a patient's reflexes. With the patient sitting comfortably on the exam table, the doctor lifts the small hammer and gives a gentle tap on the knee only to get a surprise reflex kick right in the face. Then there's the time a doctor accidentally walked into the wrong examination room and started asking a patient about their pregnancy, only to realize they were speaking to a very confused 70-year-old man. "Well," the patient said with a grin, "I'd say that's a miracle." And let's not forget about the moments when technology betrays doctors. One physician tried to pull up a patient's x-rays on the computer, but instead, their screen glitched and started playing cat videos in front of the entire medical team. Another time, a doctor tried using voice-to-text to dictate patient notes, only for the system to translate their instructions into something that sounded straight out of a horror movie. The patient needs a lobotomy immediately. 4. Nurses, the unsung heroes of medical comedy. If you ever want to hear the best medical stories, just ask a nurse. They've seen it all, and they have an amazing ability to keep a straight face in the most ridiculous situations. One nurse recalled the time a patient called her over in a panic because their oxygen wasn't working. When she checked, she realized the patient had accidentally been trying to breathe through a glove instead of the oxygen mask. 5. The power of humor in healing. While these stories are undeniably funny, they also highlight something deeper: the power of laughter in medicine. Studies show that humor can reduce stress, lower blood pressure, and even boost the immune system. Hospitals can be intimidating places, but a shared laugh between a doctor and a patient can make all the difference. Many medical professionals intentionally use humor to put their patients at ease, whether it's cracking a joke before a procedure or lightening the mood during a stressful moment. Laughter helps bridge the gap between fear and healing. It reminds us that, despite the seriousness of medicine, doctors and nurses are human too. At the end of the day, medicine isn't just about treating illness, it's about treating people, and sometimes, the best prescription isn't a pill, but a good party laugh. Conclusion: so there you have it, the hilarious, unpredictable, and downright bizarre side of medicine. From misinterpreted medical terms to unexpected situations, the world of healthcare is filled with moments that prove laughter truly is the best medicine. Whether you're a doctor, nurse, patient, or just someone who loves a good medical comedy story, I hope this journey through the funny side of medicine brought a smile to your face, because in the end, while medicine saves lives, humor makes life worth living. If you enjoyed this, stay tuned for more incredible medical stories that will have you laughing, shaking your head, and maybe even questioning how humanity has made it this far. Until next time, keep laughing, keep healing, and never underestimate the power of a good joke.